Welcome, everyone. We're very happy to have Sarah with us today. Um, Sarah has her degree in social work. She has been working with the homelessness community, with the homeless community for more than 10 years. She's worked for numerous agencies. She has experience managing the full continuum of care, including outreach, prevention, diversion, emergency shelter, and permanent supportive housing. And her passion and work have been committed to system improvement to ensure individuals and families experiencing homelessness have access to quality services and housing. And today, Sarah is going to be talking about an initiative that they have in Hartford. Um, she's going to be talking about developing housing-focused encampment strategies. Very, very glad to have you, Sarah. The floor is yours. We will have time for Q&A and a discussion after Sarah finishes her presentation. Do you want me to share the presentation or would you like to do it, Sarah?
I can share it.
As you prefer.
Great. So thanks for having me. I am Sarah Pavone, Director of Strategy with Journey Home. Um, I'm here to talk about our encampment to housing initiatives that we have been working on for about a year and a half now between Greater Hartford and Central Can. So just to give background, even though I think most folks know who Journey Home is, similar to the Housing Collective, we're the backbone agency for the Greater Hartford and Central Can, with a mission to prevent and end homelessness. We also have two distinct programs, Career Pathways and a Hand Up, to support our providers. One is focused on coordination for workforce development, and a Hand Up is our furniture bank, which actually played a pretty big role in our Encampment to Housing initiative. So to dive right in to the encampment to housing model, and I left the slides pretty succinct so that there could be enough time for Q&A, because I have a feeling normally there's a lot of Q&A that comes with this presentation, but it really is a simple model of how do you really have the most low barrier access to housing for folks that are experiencing unsheltered homelessness. Historically, we've never had, at least within our regions or to my knowledge, a separate systems process for unsheltered homelessness, even though their needs are very unique and different at times compared to our households that are in emergency shelters. So what this new model for encampment response is, it is a 3 to 4 week cycle per encampment area, based on the housing availability that you have and the size of the encampments in your region. So what a community would need to do for this 3 to 4 week process is, one, like, define what an encampment is. Every community is different, and the definition of an encampment is different in every community. We were trained on this model through Clutch Consulting, who's based out of Texas. We were about the 5th community at the time that they had worked in trying to train on this model. And we were the first community that didn't have massive, large-scale encampments. So normally, the communities that they were working in, there were encampments of up to 100 people, and they were doing large rehousing plans. For us, encampments a year or so ago were pretty small. We would maybe have 3 people at one site. Usually it was 2 folks that either found each other for safety or couples. So we were actually able to rehouse in one process. We would choose 3 to 4 encampments to get enough folks to rapidly rehouse throughout the city. So again, like your community would really need to dig into what does unsheltered homelessness look like for you, and what is the definition of an encampment that you would want to address using this encampment to housing model. You would then also want to decide like how encampments are chosen for this. Are you responding to political pressure? Are you going to come up with some sort of matrix to assess public health and safety? What will make you choose an encampment to respond to? When you're starting out for testing out this model, that might look very different because, you know, as an example, when we first tested this out, municipalities were very concerned. City of Hartford was concerned, and it was, let's start with encampments that folks can't see in case like a drove of people come to Hartford looking for housing. We don't want them showing up at Bushnell Park. If they show up, at least it will be out of sight and like won't cause like a huge public concern. So to test this, you know, we partnered with the municipality to agree on that. But as we move forward with municipalities, we really focus on health and safety. The city of New Britain and Bristol have been our closest partners in continuing this work. And usually it is due to like a health and safety risk. The land is getting bulldozed within a few weeks. One was right over a highway. And it was a huge safety concern for the residents there, as well as a safety concern for the water system based on how the encampment was set up. So again, you would really have to, as a community, what would be your basis for activating this encampment to housing protocol for encampments in your area? This also brings open communication and brings transparency with municipalities, knowing that if you do decide to work towards a matrix of prioritizing health and safety, there may be encampments that can't wait 4 weeks to be cleared. Example, like if an encampment is on an active railroad track or right next to one, it probably isn't safe to even wait 4 weeks to relocate those folks. But if your municipality buys into utilizing this like assessment tool for any encampments, there's clarity of like why and when things will be clear, even if you aren't able to wait 4 weeks for the offer of moving into housing. It brings a really strong partnership with your municipal leaders. So once you go through a lot of that pre-work and a site is identified and you're going to go through the steps of trying to rapidly rehouse them, we manage it in ideally a 4-week cycle. So week 1, you identify the encampment and you assess the site, meaning you figure out who owns the site. Is it municipal land? Is it privately owned? Is it state land? Who do you need to coordinate with for who owns that land? Outreach teams would engage the residents of that site. The first week, they would go every single day and not mention housing, not mention anything, just do the normal outreach, checking in, and start to create a daily list of who they're seeing at that site on a regular basis. By the end of the week, through their regular outreach engagement, collecting any documents, making sure they're in the HMIS system, you create almost like a closed by name list for that site. You deem who's a regular stayer at that site. We know sometimes encampments, folks are visiting, they might not actually be unsheltered when they're visiting the site. By going there every single day and creating this closed by name list, outreach has a really strong indication of who is a regular stayer that needs to be rehoused to appropriately clear the encampment. Once that closed by name list is created, you then offer housing to everyone on that list. You offer housing and immediately start identifying housing. We utilize a housing search sheet that basically asks, are there areas that they are not allowed to live in, that they can't live in? Do they have anything that a landlord needs to know about, such as prior evictions, pets, service animals? Are they only able to climb 1 or 2 stairs due to physical disability? Can they put utilities on in their name? Everything that a housing search or landlord engagement specialist would really need to have in their back pocket in trying to locate a unit. We then apply for units. This is fast tracked, as we don't wait for tenants to like go physically view a unit. We have landlord engagement specialists go and take video tours and send videos to clients. We get verbal permission or written permission to apply for units on behalf of them. And our landlord engagement specialists just apply for as many units as possible that fit the description of what they're looking for. And they look at Google Maps to see locations, they look at video tours, but we try to get things moving very, very fast and securing units and getting them on hold. Simultaneously, between week 2 and 3, you're also then focusing on all of the housing paperwork. So depending on what you're using, whether if it's rapid rehousing, you're super quick and easy, right? Like we have housed people within 3 weeks with rapid rehousing in this model. If you're looking at a PSH or a voucher that's going through JDA, then you really need to organize all of the documents and have someone overseeing all of the steps, and making sure that all of the staff are aware of all of the non-traditional ways to meet the requirements for a voucher approval and a briefing. Week 4 is then going into clearing and closing the encampment and maintenance of keeping that area cleared. So at the very beginning, the municipality would agree with you on what date they're clearing. Regardless of whether folks get housed by that date or not, like you have made a promise to the municipality, so you kind of need to hold it and support them clearing that encampment on that day. What that gives you is that gives you a month of a municipality, HPD, Public Works, whoever kind of manages encampments in your area, that they won't touch that site for that entire month while you're working. But once that date comes, they will be there to clear. We partner with municipalities and Public Works on what signage should say, how often signage should be posted. Go there the day of the clearing. Usually Journey Home was going the day of the clearing, as we didn't want outreach associated with an encampment clearing, so that if somebody was still there for whatever reason, they didn't think that the outreach worker had anything to do with the encampment being cleared. So our street outreach coordinator really took on that role if any support was needed. And then after the encampment is cleared, we coordinate with the municipality and Public Works of like what is needed to try to have this site not reestablished. Usually it's them agreeing to like fixing fencing that gets cut or broken. Is there, like shrubbery that can be planted that won't make it so easy for folks to access? A lot of the encampments we cleared, it was land that was sold that was going to be repurposed right away for building housing. So it made it a little bit easier for some of our encampments of what that maintenance would look like. So to make this really successful, it comes down to really strong leadership, as well as the project management. So to start with strong leadership, you need to have someone at your municipality within your city that feel strongly about this. So City of Bristol, the mayor of Bristol is very supportive of this work. He directs his public works departments, his HPD staff. He, asks that they coordinate with us and communicate with us. We meet with him regularly. He has even funded some of this work through opioid money that the city has had. And we created rapid rehousing programs through that opioid money to clear encampments. The city of New Britain is also very supportive, and what they do is they bring all different departments together for a monthly meeting with outreach staff. So they have HPD, EMS, Public Works, city staff, as well as Journey Home, and Friendship Service Center is usually at that meeting as the main outreach provider there. And we go over what encampments do we have, and what can we do to house them as fast as possible. And they've been a really great partner. And unless there is like a true safety risk, that they won't touch encampments, and really giving us time to house. And it's been pretty successful there as well. On the rehousing side, you also need strong leadership, because you need somebody to then kind of work some magic in navigating barriers that you might come into play with coordinated entry and by name list prioritization. What different funding do you have to be able to pull this off? Navigating, like having braided streams of funding. This is really built on a public-private partnership. You need private funds to really pull this off, because you're going to need flex funds to overcome these barriers that normally are the traditional like stop gaps in our system. You also need a rehousing lead for communications and communications management on the municipal level, as well as with any other like ED staff within the system that might want to talk about any concerns or movement with bringing an encampment to housing initiative locally. On the more like day-to-day implementation success, it really comes down to having a dedicated project manager. So Journey Home uses our street outreach coordinator position as the project manager for this work. So what the project manager does is they do a daily debrief with this cross-collaborative team that is made up of housing search staff, outreach staff, and the housing staff that is all tied to an encampment. They do what we call our daily debriefs. We do them at the end of the day. They're quick 30-minute meetings. We have a project management tool that outlines what step has been achieved for every person throughout that 4-week process, as well as a column for daily notes and daily tasks, so that the next morning someone can remember what they were assigned the night previously that they have to get done that day. And it really helps monitor the progress, and also to champion folks, to let them know that like they're doing really well, and that the work is hard and that it's worth it by the end of the 4 weeks. You'll also need, again, like a city lead for project management who's coordinating your public works department, who's coordinating HPD, so that HPD isn't going to the encampment unless it's in response to like an emergency call. Who's kind of providing notices, who would be in charge of maintenance if fences did need to get repaired, if you need people out to get quotes for repairs. So someone kind of project managing on the municipal side. And then a rehousing systems lead. This for us has been our CAN manager. They really handle all of our housing vacancies. Subsidies are our point of contact with all housing authorities. and with all of our housing providers, and really make sure that everything is updated on the BNL and housing side for any pending referrals. So high-level overview of what this looks like day to day over the 4 weeks. This is our actual calendar from one of our first encampment housing clearings. You'll see, I think Courtney's on this, so this might give her some PTSD looking at this, but the green is for outreach providers, orange is the housing team, purple is the unit team, so it's a dedicated landlord engagement specialist. Our first site, we used Hartford Housing Authority vouchers that we were able to get. They gave us a handful of vouchers to test this out. And then our first encampments were done within the city of Hartford. So we had city of Hartford staff and HPD in red. So you could see our 4-week breakdown here, and then what at minimum like was expected by each day of the month to be able to house everybody within the 4 weeks. And it also shows like when notices started to go up for clearing the encampment. So we had a partner briefing at 8 p.m. to like prep for the encampment. We started on the 9th, and the encampment got cleared by January 31st. So what's different about the approach? There is a clear, distinct role for every staff. Street outreach focuses on street outreach and engagement, and will help get, the basic documentation and people ready for that warm handoff to housing. And that is their main role. We have a dedicated role just for housing search. Permanent supportive housing and housing provider staff, they're just focused on getting them enrolled in housing and getting them into housing for aftercare. Sometimes within our system, we have, especially when folks are housed out of, shelter situations, sometimes even unsheltered, and they're just getting matched to, let's say, a rapid rehousing or PSH. We're expecting one person to do a lot of different roles, and it can become a little muddy of like who should be doing what. The housing provider thinks the shelter should be doing some paperwork. The shelter provider assumed the housing provider was going to be doing paperwork. All of that is really laid out at the beginning of this project. And by having dedicated landlord engagement staff, like it really is like a game changer for any household, having someone doing nothing but coordinating with landlords specifically. Having a daily assigned task in the project management tool is also very different. If someone hops on a daily debrief and they say, oh, like I scheduled their intake for next week. It's like, no, like you're scheduling it for tomorrow. Like we don't have a week. We really fast track the work that we're doing. We also expect housing staff to conduct all of their appointments in the community. We do not have any housing staff schedule anything in office unless it is at the client's request. A lot of times, sometimes we hear, when we get updates from housing, it's like, oh, well, they didn't show up for their appointment. So like they might have to get returned. They didn't show for like 3 different office visits. This like really throws that out the window. The housing provider and the outreach providers actually go out together, usually in one van, doing their daily visits to the encampment. And it really brings a strong partnership and like a true warm handoff in services, so that when folks move into housing, they've been working with their housing case manager for almost a month at this point, just as intensely as their outreach provider. So it brings really strong collaboration. Another piece that's different about this is prevention. Once folks are housed, we have a prevention coordinator at Journey Home that holds a monthly housing stabilization meeting with all of the housing teams to check in on anyone that we've housed from an encampment, to get any updates about any risks. And we specifically asked housing providers, like, we don't want to know when they got the notice to quit. We want to know the first time you got like an angry text or phone call from a landlord, that they weren't happy with something. Like, we want to know right away. And we have a pool of flex funds to not only get them into that unit, but to keep them in that unit. So if something is needed to support their housing stability, our prevention coordinator is kind of wrapping around the housing providers as well as the landlord to just give additional support to ensure stability. So even with all of that, we usually hear responses of like, yes, but like this can't work in our community, or we just don't have the funds to do this, or something else. So there is what's called like the creative tension model, like that happens when you're building a response strategy and building something new. And organizations can harness like the gap between vision and like current reality to create meaningful change. The tension is not anxiety or stress by like default, but it is like this creative force that is happening that can motivate you towards problem solving and innovation, of truly trying to respond in action to closing a gap that is existing within the system. And folks can either go one of two ways. They can close the gap by moving towards their vision, or they can lower their vision to match current reality. And that one is less productive. You can't operate out of a fear of failure when diving into something like this, because it really is new in the way that we operate systems, in the way that we provide support and project management to how folks move through the process. And then this slide just shows kind of what the gut instinct is, like looking at that, going back to that like creative tension model. The gut instinct is like, we have this vision to dramatically reduce homelessness, and the only way to do that is get people housed. And at the front door, we feel this pressure of like, well, we need a door wide enough to catch everybody that is experiencing a crisis. And then what we do is create this huge funnel that focuses on inflow and making sure that we could talk and see and support everybody in crisis, and then never invest in the outflow, when data suggests that like, you actually need the inverted funnel. Like, you need to be putting energy in how to exit people as much as possible, so that eventually you can right size and like reach equilibrium between your inflow and your outflow of your system. So to close out, just going through just like a few outcomes from some of our early encampment clearings. So this was the first one that tied to that calendar. We ended up having 6 individuals across a few different encampment sites. Remember how I said, our encampments were really small at this time. Started January 8th. Encampment was cleared by January 31st. 100% of folks were housed, and we had to pay, we didn't need any private funds for a landlord to accept them. So we used no funds for any incentives or risk mitigation for this first cohort to get them in within 4 weeks with housing authority vouchers. Our second pilot site in Hartford, we started in March. Same thing, it was another 6 folks spread across a few different individuals. This we utilized vouchers through JDA that were dedicated to unsheltered, and were able to house folks within the 4 weeks. Again, didn't need to tap into any private funds for these. We had 100% leased up without any incentive or risk mitigation. And then we started expanding this into central, and this was our first central encampment clearing. This was on a state property, cleared within 4 weeks. Again, used JDA vouchers, dedicated to unsheltered, and 8 folks were originally there. 1 self-resolved before the first week. So we ended up only offering housing to 7, and 100% accepted. We did, for the central encampment, had to use an average of $600 per household as an incentive or risk mitigation. To date, we are at about 55 house, and we have another 27 that we're actively project managing and housing search right now. We've had 100% of folks accept housing that have been offered housing. And in the year and a half, we have had 1 return to homelessness. And I will stop there for any questions.
Thank you, Sarah. And everyone, please feel free to raise your hand, or you can put your questions in the chat, and we'll take it from there.
So I've been, asked to help coordinate some things on the city side. When we've had the, few here in Stamford. So I guess my question would be, what things could the municipality do, or how could I rephrase that? You've had like a timeline and all of that. I guess, how do we start to, I guess, talk about, maybe doing this, more coordinated, a little bit better, because it wouldn't be us who would take the lead. It would, we would just be partners. So, I guess that would be my question. What things within the municipality or conversation should be had to support this?
Yeah, that's great. So there's a few different things, and I could send the additional forms to the Housing Collective after this meeting, but there are like templates for municipalities if you want to start assessing where you're at in terms of your readiness in all of the different lanes of work, from municipal leadership to housing leadership to funding. If you really wanted to try to roll out this encampment to housing system, and also gives you kind of like a breakdown of just test one site, right? Like you don't need to be committed to a huge system overhaul. Like try it once, like get enough for just a few vouchers, like try it once and like see how it goes and see what the learning is. So I would say the first would be connecting with the Housing Collective and starting to have those conversations of what would that look like in Stamford? What are our resources? What are our strengths, and where are gaps to potentially even get to a test site within Stamford? I will say, outside of like the encampment to housing work, something that we've been doing for a while is we do have a like electronic referral form or notification form for municipalities throughout our regions, where HPD, city staff, EMS report encampments to us to make sure they're on our radar. And then depending on like how frequently encampments exists within that region, we meet with them regularly to like review the list, review and coordinate our response. So I would say like even prior to maybe getting to a test site, like that is something that can be done like immediately. It's just how to increase communication and coordination. So City of Hartford, we have lots of encampments. I meet with the city staff once a week. New Britain, we're down to one encampment in New Britain through this work. We meet once a month. And same with Bristol. We're down to about a monthly meeting just due to rehousing quite a few folks within that town. So I think there's a few different options, and I could send some of those templates, like I said, to the housing collective so you can connect directly with them to begin those conversations. Albana, did I say your name right?
You did. Thank you so much, Sarah. It was a great presentation. Just a couple of questions. Does this, the encampment, then how does it work with your shelters, right? So if you already have folks that are in a shelter, does it change the amount of time they have to wait for their permanent supportive housing? Is there any, you know, there are two, parallel pathways, or are they interfering with each other? Number one. Number two, you mentioned that you've been very successful, and kudos to you guys for doing that work, and only one person returning to homelessness. City of Waterbury here, from what we hear from the folks, especially the boots on the ground, is that the level of the acuity, the level of need for our clients, it's much higher sometimes than what we can provide. And how does that support system, like you are about a year now, right, into this pilot, and it's working quite well for you. What pointers you can give more that can help any other town to be more successful in terms of that rate of retention of clients, and what does it look like?
Yeah. So to answer, those are both really good questions and ones that we get asked often. So for your first question, we've actually committed to only using new resources for this work. So we have not pulled from existing canned resources that would change any existing like by name list prioritization. So we use our Snowfo PSH vouchers that were dedicated to unsheltered. We've gotten housing authorities just to commit vouchers to us based on the success of this model. So Hartford Housing Authority, Bristol Housing Authority, we've gotten opioid money. We've used ARPA dollars to create rapid rehousing programs. So we've only brought in new resources. So our shelter system hasn't seen a huge impact. I will say part of our planning with this, though, is how do we better implement housing out of our warming centers in the winter months with the seasonality of our work, and maybe how to focus on doing rapid rehousing large cohorts out of warming centers to free up space and also reduce the amount of folks that are exiting to unsheltered homelessness at the end of the season. So that's something we haven't like done strategically yet, but we have housed out of the warming center last year. The second question I would say is we haven't implemented it yet, but I think it's either Texas or Oklahoma actually got their housing providers to commit to like a vulnerability tool of how often they would do home visits based on different characteristics that the household was experiencing. So if someone was deemed more at risk based on like these like 4 or 5 different identifiers, then that housing provider would commit that that is a minimum of a once a week home visit, regardless of the client engagement of physically going to the house at least once a week. And it was like it's like a 3 different categories for like the level of case management engagement to kind of respond to that acuity that you're mentioning. I will say, like, no surprise, where there's been really strong case management and strong relationship, we've had more success. When there isn't always case managers regularly going out to check on folks, we normally need to step in a lot more with prevention support. So I don't have like an easy answer for you other than like yes, like acuity can be high for some of our folks, but also like there are services and partner agencies. It isn't just all on us. What behavioral health agencies are we partnering with? Like what true system coordination are we doing to wrap around services for these folks appropriately? I do think there's like a different way of working that where folks can stay housed, for the majority of folks at least. And I'm just looking at the chat, our flex funds and private funding from municipalities. No, so a lot of our flex funds and private funds, we have just applied to local foundations to get like a few $1,000s here and there, for landlord incentives, risk mitigation. Our United Way, was a supporter for prevention funds and supporting encampment work. Same with Hartford Foundation for Public Giving. So any foundational support that you can get, is where most of our private and flex funds have come from. We have, in some cases, like our board has like matched some of our like unrestricted dollars to kind of help bring in more foundation funds. And is this initiative available in Fairfield County? That would be a housing collective question, but hope so. Love the idea of a housing representative obtaining a unit on behalf of the client. Please elaborate how this works. So yeah, like I said, we have a sheet filled out, between the outreach provider or the housing provider and the client of what type of unit they're looking for, areas that they absolutely, like I said, like won't or cannot live in, for a multitude of reasons, any specific needs they have. And we have a pool of landlords that we have relationships with, as well as just looking at the market and building new relationships. And we get approval to apply to all of these units on their behalf. We use our flex funds to just pay for all the application fees. If ones are charged to us, sometimes we're able to even get those waived. And we basically kind of put units on holds, and have clients accept the unit. Some clients don't even want to physically go to the unit. They're good with just the video tour and seeing where it is on the map. They know the neighborhoods pretty well. They know where they're willing to live. Some are adamant that they really want to view the unit, afterwards. And if they do, that's fine. But at least we've already applied and like gotten it on hold so that if they say yes, like it's immediate. We start the process immediately with like an RTA or a lease, if they're doing like a rapid rehousing intervention.
There is another question in the chat. What do you do when you have members in an encampment who do not want housing or shelter?
Yeah. So many folks don't want shelter. And when we've heard concerns, from housing directly out of encampments, you know, if there was a concern that we'd be like skipping prioritization, or the folks that we've been housing for the most part have been like off the grid and outside for years and years because they have become so distrustful of the system and so distrustful of shelters that like they are a priority. They actually just like might not even be active in our system because of how disengaged they've been. We have been hard pressed to find somebody that doesn't want housing. And your day one engagement, they might not want housing because it's their defense mechanism to not have hope in something that has failed them over and over again previously. Like you showing up every single day to that encampment will eventually start to have their wheels turn of like, oh, this is different. No one's ever shown up every single day for me. An example of this would be, we had one encampment, and we were showing up every single day. And I was on site for a lot of this in the beginning, just because I was getting trained by Clutch Consulting myself. And this guy like just would not talk to us. Like he would not talk to us. He would not engage. By like day 5 or 6, he finally came out of his tent and he was just like, I have nothing to sell you. Like, why do you keep showing up here? Like, what? Like, he's like, let's just talk because I don't understand why you're continuing to come here every single day. And we finally were just like, oh, hey, like, nice to meet you. Like, let's get to know each other. Are you interested in like housing? And by the end of the 4 weeks, he was like hugging and crying like in his new apartment because he never believed someone would actually like be that invested in him before. On the other end, you know, we had a woman outside for over 5 years. She had 8 cats, I think. And she just didn't think she could ever get housed. Like no one would ever house her with 8 cats. And she was adamant that she was not going to go into housing. And we just said, okay, like, well, then let's just walk through options. Option A, like your dream option is like you move in with your 8 cats. Option B is like 7 cats. Option C is like 6 cats. We ended up with the option where she moved in with 2 cats with an agreement from the landlord that like he would review and allow more cats to enter as she showed that she had like good tenancy. She had multiple cats within like a few days of moving in. But she's still housed and she just did her recert in January and we figured it out. So like there just is there's always a solution to a problem that the folks are presenting to you. Like that is what's different about this. There is no like, well, we have to return you to the can because you're just saying no today. Like if you offer them housing, like you've offered it to them and you're going to offer it every single day. And eventually they say yes because now they're starting to believe in something again.
Thank you, Sarah. Any
Yeah.
other questions for Sarah?
Would it be possible to have Sarah's information just in case if we have any questions to contact her? On your website, it's just your just your name,
Yeah, I'm gonna
how
put
much.
my email in the chat.
Thank you.
All right. So if there are no more questions, going once, going twice. All right. Thank you very much, Sarah. This has been very interesting and hopefully will open up possibilities here in Fairfield
That's
County.
great. Thanks for having me. Thanks so much, guys.
Thank you,
Thank you.
Sarah. Really, really appreciate this.
Yeah, of course. Bye all.
Bye.